Triage is going to assess and assign every patient to a specific zone with the colored slap band. Patient who comes in with a red slap band goes to the red zone, which is the trauma rooms with overflow out here.
He is so good. That, of course, is Dr. Michael Robbie Rabinovich, played by Noah Wyle on the hit TV show The Pitt. The actor is no stranger to playing a doctor on television. He also starred in ER for more than a decade. We remember that. His mother, Marjorie Wiley Katz, has been a nurse for 4 decades. Today, the duo is in Washington, D.C., speaking with lawmakers about policy changes that could help with burnout and staffing shortages among healthcare workers. But before we talk to them, we're going to hear from Dr. Sanjay Janesha and Nurse Farida Lebron about why additional protections are needed. Watch this.
We went into these professions to take care of people, and sometimes it feels like there's so many barriers in the way of us being able to do that well.
We all know that there's staffing shortages, that the demands are increasing.
I had my fair share of burnout after COVID. I had to even step away from one of my jobs during that time because I felt broken.
It takes a toll emotionally, it takes a toll burnout-wise.
The more people that leave the profession, the more work for those who are in the profession. And then there's still no support to check in and make sure that we're doing well mentally.
It's reported about 50% of healthcare workers feel that they are, not adequately paid for what they put in, be it emotionally, mentally, physically, or in labor.
There's a lot of paperwork, and so sometimes it takes us away from what's most important and what we went into this position to do, which is take care of people.
Only on CBS Mornings, Noah Wyle and his mom, Marjorie Wiley Katz, join us from Washington, D.C. Good morning to you both.
Good morning. Thanks so much for having us.
Thank you for having us.
We're so excited. We've been talking about it all morning. So Noah, let me begin with you. You wanted to create the Pitt to show what it's like to work in medicine, and you specifically wanted to do it after the COVID pandemic. What did you learn about frontline workers from just working on the show?
Mostly the toll that it's taken since COVID on them, mentally and physically. A lot of these people have been in these tours of duty nonstop for 5 years without a break. So I came to Washington at the invitation of FIGS to join 18 ambassadors, brand ambassadors representing various aspects of healthcare, here to help lobby for 3 pieces of legislation to improve their lives a little bit.
So why was it important for you, though, to show this realistic side? We all love, Gayle and I and Nate have been talking about ER all morning long, how great you were as Dr.
Yes, Dr. John Carter, I'll never forget you. I'll never forget you.
But this is a very realistic depiction of life in a hospital.
Yes.
And so
in real time.
In real time.
Yeah.
I mean, every 1 hour episode is an hour in the day in the life of the doctors working in this Pittsburgh emergency room. Why was it important for you to nail it?
Yeah, this was sort of scripted as a love letter to... This was intended to be a love letter to frontline workers and healthcare workers, to let them feel very seen and heard right now. ER was a wonderful depiction of healthcare in America pre-COVID, but there hadn't really been a show that was addressing what was happening post-COVID yet. So that was the design, was to see if we could just present a very accurate snapshot of what it looks like in a hospital emergency room in America right now.
And Marjorie, I want to talk to you about being a nurse, because I will never forget going through a very painful delivery. It was a nurse that got me through. I remember seeing her blue eyes saying, "Gayle, you can do this." And I'm like, can I really? Can I really do it? She goes, "Yes, you can. Yes, you can." And I have not seen her since the birth of my son.
But she meant a lot to
you. But she meant, Debbie, I'll never forget her. And that's what I think nurses and doctors do in the healthcare industry. These people come when you need them most, and then you never see them again. What do you want people to know about the challenges that the frontline workers face during very difficult times in our lives? What do people need to know?
People need to know that nurses are advocates for patients.
Yes.
We're on your side. And nursing is a terribly hard job, and I think nurses are not adequately compensated for that. Nurses are considered a cost center for most hospitals, whereas doctors are considered a revenue center. Nurses can't bill for their time and their skills. And whenever there's a budget cut, the nurses are the first to go. And also, then I'd like to talk a little bit about safety in the workplace for nurses. When patients come to the hospital, they're either injured or sick, and they're very afraid. they're not seen often in a timely manner, which leads to frustration and which escalates to anger. Most of the time, it's about 90% verbal abuse because the nurse is the handy target. But as you saw in the Pitt, it sometimes can escalate into an assault or a physical abuse. And we need to protect nurses.
No doubt about it. And you two are on Capitol Hill today with a group organized by healthcare apparel company FIGS. You met with lawmakers about greater protections. Just like Marjorie, you are mentioning some of those eye-opening facts about what nurses are going through. And we should note the appearance today is furnished by FIGS. What reforms are you advocating for, Noah, specifically?
There's 3 bills in particular. One is to pass and fund the Lorna Breen Act, which passed both the House and Senate in a bipartisan manner. It is geared towards making evidence-based mental health resources available to frontline workers. The second is a piece of legislation called the Awesome Humans Act, which is geared towards offering tax credit to frontline workers, where there hasn't been one before, to offset some of that pay disparity. And the third one is geared towards relieving administrative burden and paperwork off of the staff, who sometimes have to spend up to 2 days during their week just doing prior authorization forms, which takes away from the quality of health care. So this is not just a workforce problem. This is a patient care problem. The trickle down of these things not being enacted will affect all of us eventually. And we're here to underscore that the strength of our health care system is commensurate with the degree to which we support our health care workers.
Not John. Noah, sorry.
Oh, I answered everything.
I can't believe I did
Robbie,
that.
Noah.
Noah, I would
so
imagine you have a
flattering,
lot
Gayle.
of medical knowledge now, but when you were first starting out, you can call me Beyonce. I would imagine you have a lot of medical knowledge now, but when you were starting out, I don't think that was the case. Your mom, on the other hand, Marjorie, you've had tremendous medical knowledge throughout watching Noah take on the roles. Did you ever give him notes during his career? He plays a doctor very well on TV.
Ever give me notes?
Yeah.
Ever give me notes?
Noah.
He always says that I called him at 11:01 p.m. and told him what he did wrong. And now, through the internet, now he has about 16 million moms who can tell him what he did wrong.
Yes.
Yeah, it must be fun to watch him playing the roles
She's got
that he
a whole
plays.
army out there working on her behalf to point out my discrepancies. Yeah.
Yeah, but it must be fun for you, Marjorie, to watch him play the roles so well. And for you, Noah, I bet people think you actually are a doctor. If you're at a party, I bet people have lots of questions for you. Marjorie, you go first.
It is fun for me, and I want to tell you how much I admire Noah and all the people on the Pitt for bringing healthcare to the forefront and all the crisis that's happening now in our healthcare system, and for making their show a platform for change.
Very nice.
Well, Noah Wyle.
Thank you for offering my mother a platform to tell her she's proud of me. That was great.
I admire him. Proud sounds a bit possessive, and I wanted to say that I really admire you.
Aww.
But Noah, you admire your
Likewise.
mom too. We could see the way you two were looking at each other
And interacting
What you have,
before.
what you have is a mutual love and admiration society. I love to see it between a mother.
Can I
and a
just
son.
say briefly that I am so excited to be here in Washington with my mother. I'm so excited that both of our careers get to dovetail together in an act of advocacy and allyship for people. This is a great moment for us.
You two
Well,
are giving
Noah,
us all the feel.
Marjorie, thank you so much for joining us. We appreciate you so much.